Candesartan is one of the medication that is classified as angiotensin 2 receptor blocker, commonly known as ARBs. Here we can identify the suffix sartan, which indicates it is an angiotensin receptor blocker. It is available as a tablet and it is well known under the brand name Atacand. Candesartan can be used in the treatment of hypertension, where it can reduce the blood pressure by inhibiting the actions of angiotensin 2. It can also reduce the risk of stroke and kidney problems in people with high blood pressure. Another use of this medication is in the treatment of heart failure, where it reduces blood pressure as well as reduces cardiac work. This improves the symptoms of heart failure. However, Candesartan should be used carefully because it is going to inhibit renin-angiotensin system. So in this video, we are going to discuss important facts about this medication. First of all, let us see how this medication works. Candesartan acts as an antagonist at angiotensin 2 receptors. It blocks the actions of angiotensin 2. These medications can reduce the blood pressure by inhibiting the actions of angiotensin 2. This reduces the vasoconstriction produced by angiotensin 2, leading to decrease in the blood pressure. Thereby, it reduces the cardiac work and increases its efficiency. Candesartan can also reduce the secretion of aldosterone, which is one of the hormones that is responsible for reabsorption of sodium into the body. Therefore, Candesartan reduces the sodium retention and reduces the body volume. This also improves the pumping efficiency of the heart, thereby it relieves the symptoms of heart failure. Candesartan can reduce the blood pressure by blocking the effects of angiotensin 2. As the blood pressure is reduced, the workload on the kidneys is reduced. That increases the filtering capacity as well as it can prevent further kidney damage. Now let us see the precautions of this medication. Candesartan can produce angioedema. Angioedema is one type of allergic reaction that may be produced by AC inhibitors or ARBs. Generally, ARBs are having the less risk of developing angioedema compared with AC inhibitors. It is one of the conditions that results in the swelling of deeper layers of the skin and tissues. Particularly, it can affect the muscles at face, leading to facial swelling, swelling of tongue, throat, and limbs. The swelling of the throat and larynx may result in the difficulty breathing, and it may also lead to serious complications. In case of development of angioedema, these medications should be discontinued. Candesartan can produce another condition, hyperkalemia, elevated levels of potassium in the body. Hyperkalemia results in the elevation of potassium levels above 5.5 millimoles per liter. Potassium is one of the important electrolytes that plays an important role in controlling the functions of neurons, muscles, and even the heart. When its levels are going to be elevated, it may produce some impairment in these functions. People may have few symptoms like muscle weakness, palpitations, chest pain, difficulty breathing. Particularly, ARBs can interfere with the kidneys function and they reduce the excretion of potassium. This may result in the more retention of potassium in the body, leading to hyperkalemia. Particularly, this is more pronounced in people with impaired kidney function or pre-existing diabetes. Candesartan should not be used in the people with bilateral artery stenosis. It is one of the conditions where both of the arteries connected to the kidneys are narrowed, leading to decreased blood flow. When angiotensin receptor blockers are used in the people with bilateral artery stenosis, it may result in acute kidney injury. This may result in the sudden decline in the kidney function, and it may also lead to severe life-threatening complications. That's why in people with bilateral artery stenosis, angiotensin receptor blockers should not be used. Candesartan mainly produces vasodilation, therefore they can produce few side effects that are related to dilation of blood vessels. Particularly, they can produce dizziness and lightheadedness. This is common with ARBs and it can be observed even with first dose of this treatment. They can also produce fatigue, where people may feel tired. Headache is another common side effect. Even though rare, it can produce dry cough due to accumulation of bradykinin. However, this dry cough is more pronounced with AC inhibitors. Candesartan can also increase the potassium levels, leading to hyperkalemia, which may produce rapid heartbeats and muscle weakness. Few of the hypersensitive reactions like angioedema may also be possible, leading to swelling of face, tongue, and throat. However, this angioedema is less pronounced compared with AC inhibitors. Hypertension is another important side effect that is more pronounced in people with volume depletion. Lithium is a mood stabilizer, which is also called as anti-manic agent. It is particularly used to treat bipolar mania. However, this lithium can interact with medications like Candesartan. Angiotensin 2 receptor blockers can inhibit the renin-angiotensin system, thereby they can affect excretion of few of the ions. Particularly, angiotensin 2 promotes the secretion of aldosterone, which is responsible for reabsorption of sodium into the body. Since ARBs block the actions of angiotensin 2, aldosterone secretion is reduced and sodium is not reabsorbed into the body. This results in the increased excretion of sodium in the urine. To restore this condition, body tries to reabsorb the lithium because both lithium and sodium are monovalent cations. So in presence of ARBs, lithium is more reabsorbed into the body, leading to more retention and accumulation of its levels in the body. This results in the lithium toxicity, leading to few symptoms like tremors, vomiting, diarrhea, and even seizures. That's why whenever ARBs are taken with lithium dose should be properly adjusted. This medication is teratogenic, therefore it should not be given to the pregnant woman. It can produce a fatal injury or even death. That's why in the pregnant woman, this medication should be avoided. Now let us see the dosage of this medication. Candesartan is available as a tablet at different strengths starting from 4 mg to the 32 mg. The dose of this medication depends on the type of clinical indication. For the treatment of hypertension, it can be started at a dose of 16 mg per day. However, this dose may be given as divided doses, so it can be started at 8 mg given twice daily. Based on the response, the dose may also be increased to 32 mg per day. When the dose is going to be increased, it is given as divided doses. In a few people, the dose may also be reduced to 8 mg, where it is given as 4 mg twice daily. For the treatment of congestive heart failure, Candesartan can be started at an initial dose of 4 mg per day. After 2 weeks of the treatment, the dose may be increased based on the relieving of symptoms. So that's all about this medication, Candesartan. I hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thanks for watching. See you in the next video.